All right, I'm gonna start admitting persons. Good afternoon, everyone. Thank you for joining us for our beneficiary educational session brought to you by the National Health Insurance Authority. Can everyone hear me? Dr. Jill, can you hear me?
Yes, I can.
Okay, perfect. All right. All right. Good afternoon again. Thank you for joining us for our monthly beneficiary educational session brought to you by the National Health Insurance Authority. My name is Chandra Sawyer, and I'm the Healthcare Wellness Specialist here at the National Health Insurance Authority. And our focus for today and our topic coverage at our beneficiary educational session is dental care and your health. And so we are coming to you live via the Zoom meeting room as well as via Facebook Live. And so we welcome you to share the information with your family members and friends who are not joining us currently. So, who are we? At the National Health Insurance Authority, our vision statement speaks to the fact that we are leading the way in providing access to affordable quality healthcare that Bahamians deserve. Our mission statement: we are transforming the healthcare system upon which the future well being of Bahamians depend by putting patients at the center of every decision we make. Our core value speaks to us being passionate about bringing universal healthcare to all Bahamians. We are progressive and relentless in expanding access to quality healthcare through progressive solutions that are supported by technology. We thrive on partnerships, and so we are dedicated to delivering that affordable healthcare through partnerships. We operate with integrity, and so we are committed to doing business with integrity, accountability, transparency, and sincerity. And we respect and honor our beneficiaries by providing care in all aspects of our service. And so our focus at the National Health Insurance and our Wellness Program, we focus on three tenets. And the first one is we want to encourage Bahamians to incorporate exercise and physical activity into their daily routine. We want Bahamians and the public at large to understand that your food should be your medicine. And it is ultimately important for you to also focus on your mental, emotional, and spiritual health. Our overall goal is to ensure that Bahamians understand the importance of living a well balanced life that will ultimately lead to enhancing the overall health and well being of our nation. And so, where are we now in the NHI Bahamas program? Since our inception in 2017, we have advanced the path to universal health care coverage. And so our enrollment growth speaks to over 160,000 plus Bahamian citizens and residents have enrolled into the program. Our demographic is very diverse, and we can boast that we, we have enrolled Bahamians and residents from more than 17 islands, which include 7,000 plus Bahamians under the age of 5, more than 30,000 school age children, and over 20,000 plus over the age of 65. And we call that population our precious pearls. 96% of our beneficiaries who are enrolled in the NHI program are satisfied with the service that they are receiving. Our provider network is very expansive. And so we are currently in partnership with 139 physicians across 88 primary care facilities across eight islands. And we're also in partnership with 14 labs across 21 locations. Our digitally enabled healthcare system, we boast of our electronic health record platform, where the telehealth feature is enabled for applicable visits. This afternoon, dental care and your health is our subject for today. Your oral health is more important than you might realize. And so, here to tell us how the health of your mouth, teeth, and gums can affect your general health is dentist Dr. Gill Gibson. And she is a proud 1980 graduate from Queens College, and she also graduated in 1987 from Marquette University School of Dentistry in Milwaukee, Wisconsin. She has over 38 years of private practice experience in the dental industry, with 3 years of practice in the dental department at the Princess Margaret Hospital. She has served as the president of the Bahamas Dental Association and is a current member of the Bahamas Dental Council. She has also served on the Hospital and Healthcare Facilities Board. This afternoon, we want to take the time to welcome Dr. Gill Gibson as she presents to us on dental care and your health. While Dr. Gibson is presenting, you are welcome to drop your questions, place your questions in the chat feature in the Zoom meeting room and on Facebook or on Facebook Live. And we will read those questions to Dr. Gill during our question and answer period. Dr. Gill, we want to welcome you. You are on.
Thank you very much, Ms. Sawyer. Do appreciate the opportunity. I'd like to thank the National Health Insurance Authority for inviting me to come and present to you and your partners. It is indeed my pleasure. I am passionate about dentistry. I love what I do, and I love sharing and educating, helping to educate Bahamians on their oral health, and particularly in this case, oral health and the overall health of our body. So I'm going to try to keep this as simple as possible. And certainly I do invite questions. And I will do my best to answer all that I can for you. So I'd like to begin by stating that the World Health Organization has recently placed oral disease on their list of non-communicable diseases. We hear this thrown around. So what is a non-communicable disease? Simply put, a non-communicable disease is a disease that cannot be shared, cannot be passed on. It's yours, and you've got to deal with it and make certain that you have that under control. And so one might say, well, what's the big deal about that? But what that does is it does give oral disease and diseases of the mouth real teeth, no pun intended, but um, it makes it, as Bahamians would say, a true disease. Oftentimes it's neglected and saying, well, I have a cavity or I have a bad tooth. But in fact, there is disease. And so with the World Health Organization doing this, this puts it to the forefront, not just for us in the Bahamas, but worldwide, that your dental health is important and in fact is a disease that needs to be controlled. So I'm going to attempt to share just a few slides with you here as well and give you just an idea of what we're talking about. It's obviously dental health is quite comprehensive and we may not get it all in today, but I will do what I can to um, get some information to you. So if you just give me 2 quick seconds here, I will try to get this going and get us some slides. Okay, so can everybody see that? Are we all seeing that? I hope you are. So first thing we want to talk about is our diet. And I think we've all heard the term over and again that you are what you eat. And so we are encouraged by our healthcare providers, by dentists, our nutritionists, our doctors, to be ever cognizant, ever aware of what it is that we're putting in our bodies. And I think we are all aware that the only way that we can consume all of our nutrients is through our mouth. And so I am appealing to our healthcare providers, our partners, nutritionists, to take a look at your patient's mouth. It's one thing to say to patients, you've got to eat a nutritious meal, a balanced diet. All these things are all well and good. However, you need to be more vigilant. We need to be more vigilant with oral examinations. If you're asking a person who has multiple diseased teeth, missing teeth, to consume a nutritious diet, it's going to be rather difficult for them to do that. And most times people won't admit that they have a problem actually consuming these things. And if not properly chewed, then these things can create bigger problems for us. And so you got patients trying to eat and things are not properly, we know that they tell you that you've got to chew your food a certain number of times, but if teeth are missing, then there's not proper mastication, not proper mashing of the food so that the food can get into the body to be properly digested and the appropriate nutrients being digested and extracted from the foods so that you can have a healthy body. So that's the first thing we need to make certain that we are examining, giving oral examinations to our patients. And if things are not as they should be, if you recognize that there are problems from the patients, then they need to be referred to the appropriate dental offices to make certain that these things are corrected and that the disease processes can in fact be treated. And so then we can get to consuming and eating a proper diet. So we see that the oral health, simply needing to have the food go through the mouth and to get into the body is one of the very big things that first things that we have to be able to do. The next thing that we talk about a lot is inflammation. The word is thrown around. Often you hear there's inflammation of any part of the body can have inflammation. And this inflammation is not isolated to just a particular area. Our bodies are wonderfully and beautifully made by God, and it's amazing how intricate and how connected it all is. And so when we start talking about inflammation, we're talking about the body's response to something that should not be there. Okay, that's the simplified version of it. The body will attempt to protect itself from any harmful, unnormal stimuli, anything that it feels does not belong there. And the way it does that, and the biology of it is very complex. But the simple way is that the body will send out uh, responses to attack what is not supposed to be in the body. And that results in inflammation. And the body, again, is very, very kind to us. And like I said, God made no mistakes in making us because it does give us signs. And some of these signs will usually be heat, pain, and nobody likes pain anywhere in the body. I think we could all agree on that. Swelling, redness, and loss of function, whether it be in the mouth or whether it be anywhere else in the body. Inflammation, the pain, the swelling, the redness can result in a loss of function. And whether it be from the pain or the swelling, loss of function also affects our ability to work. And here on the slide, you'll see a picture of a swollen jaw. I think we've all seen persons walking around looking similar to this, and this is very unfortunate. But this is a sign that obviously something is very, very wrong. On the other slide, on the other side of this picture, you will see what we call periodontitis. Big word, basically ends up being inflammation of the gum and also resulting in problems with the surrounding structure, which is the bone. The bone needs to be healthy in order to have the teeth present. And so these are some of the signs that you will see in your body that you need to respond to. Bleeding gums is disease. If you have or you find that your gums are bleeding, there is some disease going on. You need to see your dentist. So that is the body's response to something that shouldn't be there. And most times there will be the something will be plaque. We call it plaque, but in fact it is bacterial plaque. We call it tartar, but in fact there is bacteria in the tartar. And so the bacteria is what is going to have the body respond by sending out signals and signs that something is wrong. So we need to address that. The inflammation also is a chronic low grade infection. And that too needs to be addressed. And the reason for that is that the bacteria is not isolated to the mouth. We have to remember that the same blood that is in the mouth goes through the entire body. And the heart, which is ultimately responsible for sending the blood throughout our entire body, this bacteria can get into your heart. And if in large enough amounts, it can create a problem. So persons who already have heart conditions and heart disease can be very susceptible to having that disease become a bigger problem if they're not addressing their oral problems. Because the blood, the bacteria that will get into the blood will go through the heart and create lots of problems. Now, I'm simplifying this, but these are the things that I want you to just sort of start thinking about so that if you need to see your cardiologist or your doctors, if you have to, I just want you to be reminded that the same blood is going throughout the entire body, and so that can create a problem. And so we have to make certain that you keep the mouth clean. Tooth decay, we talk again about it as if, okay, I have a cavity, doesn't sound like a whole big problem. However, that too is caused by bacteria. And so the bacteria then being the resulting cause of a lot of our problems. The other thing that I'd like to touch on again today is the diabetes and oral health. We've got a big problem, I think, in our country with both heart disease and diabetes and oral health and diabetes. There are some, even if you aren't a diagnosed diabetic, oftentimes the dentist might be one of the first persons to, in fact, be concerned or have issues with the fact that you potentially may be diabetic or pre-diabetic. And some of the red flags that we would see would be if a person were to have an extraction, to have a tooth removed, then there's problems with healing. If that extraction site, the area where the tooth was taken from, takes an unusually long or extremely long time to heal, that may be a sign that something else is going on because this bacteria is not being able to, the body is not being able to deal with this bacteria. Something is happening. And so that may be one of the red flags. The other thing that may be a signal to the dentist is that a patient comes in and it's early morning and they're having a procedure done, but their oral cavity, their mouth, seems to smell as if they've been having a couple of drinks, that they may even smell like they've been a little tipsy, but they're not behaving as if they're a little tipsy and they haven't had anything to drink. And that is because the alcohol, it's called alcohol breath. And that is one of the things that may occur in somebody who's diabetic as well. And so you may not even know that you have a problem with diabetes, but these are some of the red flags, some of the things that a dentist might see and become concerned about and advise you to have your doctor give you a check. And so we need to make certain that we are collaborating with physicians and health nutritionists about our patients and their diet and their overall health. We've got to connect the two and we've got to work more to closely to make certain that this happens. The other thing that we may find in diabetics is that they may have dry mouth. A patient will come in and complain frequently of having very dry mouth. They're always thirsty. That is one of the potential signs of somebody who may be diabetic as well. This is just one of the things potentially of dry mouth. There's a lot of other things that can cause dry mouth. And so these are some of the things that we may see as dental practitioners that we will alert our patients to have more examination and checking. Now, persons who know that they are diabetic have to be very concerned as well about their oral health and their oral cavity, their mouth, what's happening in their mouth. Keeping a Obviously, we know that again, like I said, the bacteria in the mouth is always going to be there. It's the high levels of bacteria. So we've got to do our best to control that. And we need to make certain that we're having, as diabetics, you're having regular cleanings, that you keep your mouth as clean as possible. And this will help to control not to control your diabetes per se, but help you to control how you are reading your insulin levels. If there is bacteria around, and like I said earlier, that it's a chronic low grade infection. And let me give you an example of what I mean by that. If you were to have a splinter, I don't know, most of us have had splinters from something, a piece of wood, a prickle, and you see the area gets red and just doesn't heal, and then you can't touch it, and it just seemingly never goes away because of the presence of this tiny little splinter or prickle. And that is what we call a chronic, it begins as inflammation, but it can go and become a chronic low grade infection. It just doesn't heal. And so if this is present in your mouth in the form of gum disease, in the form of decayed teeth, this can affect and give you false readings with your insulin. And so you're thinking that your diabetes is not controlled and your physician, you're playing with your insulin, you're paying with your medication and having to make adjustments. But going and having your teeth clean, having the gum disease, having the oral disease addressed will help to get a better handle on really what is happening with your glucose levels, with your sugar levels. And so that for diabetics is very, very important. So I think that this brief uh, information and dialogue will hopefully open your eyes to the fact that you need to have your oral disease, your mouth disease under control so that your entire body can in fact function properly and we can achieve optimal health. It really doesn't do us any good to feel that we are healthy and isolate our mouth as not a part of our body and making certain that that too is healthy. So I appeal to all of you out there and to all of you who may hear this later in the recording to please make certain that you ensure that your mouth is kept healthy, and that creates for a happier and healthier you. Thank you so very much for this opportunity. And I continue to pray that NHI, the National Health Authority, will continue to work with Bahamians to make certain that we have a healthier Bahamas. Thank you very much.
Thank you so much, Dr. Jill, for that wealth of knowledge. And thank you for breaking down the different scenarios, the different case studies. I found that that was very appreciative and eye-opening for me, having to sit through your presentation. And thank you for that knowledge.
You're
We had
welcome.
a question. My pleasure. We did have a question about heart health that was placed on Facebook. And
Mhm.
for those that are listening, if you have questions for Dr. Joe, feel free to place them in the chat as we will now begin our question and answer period. Um, can you elaborate a little bit more on how oral hygiene can affect your heart health? The person is asking, is this true that oral hygiene can ultimately affect your heart health?
Absolutely, absolutely. I like I said, I touched on it just a little bit, and obviously you can get into all the there's a lot of details
Yes.
um, that can get into the science of it. And I didn't really want to get into all of the science of it, but simply put, the like I said, we have to remember that the bacteria, and that is really what is creating a problem. The bacteria that gets into our bloodstream from the mouth will eventually get into the heart. And so the blood vessels of the heart, bacteria can get into those areas and can attach themselves to the lining of the blood vessels. There are also valves in the heart. And so these valves open and close. Okay. And so if bacteria were to get trapped and underneath or above or in any area of those valves and begin to grow and begin to develop and become overwhelming to the body and subsequently to the heart, then that too can create a problem. And that's called a bacterial endocarditis. That is what can happen, that the bacteria can get into. And that is really the biggest problem with heart disease and oral health, is that the bacteria flows through the body.
All right. So, Dr. Joe, how often should we engage in dental cleaning?
A minimum of once or twice a year, optimally. However, there are cases and there are many persons who need to have their teeth cleaned, just a general cleaning, more than once a year for multiple reasons. Persons who do have uh, diabetes, some patients have a tendency to build up more bacterial plaque and tartar a lot more frequently. And so The dental instruments are best used to remove that from the mouth, and sometimes that has to be done more frequently. Some persons may have to have their teeth, a professional cleaning done 3 or 4 times a year, but on average, twice a year.
Okay, thank you, Doc.
You're
Doc,
welcome.
another question came in. My appointment was canceled by my dentist because I am a diabetic and was on aspirin for teeth cleaning. Can you tell me why or why was this?
Um, well, I can suggest why it was.
Okay,
The there are two factors there. The patient indicates that they're diabetic, and so
correct.
diabetics tend to not heal as well. Now, without knowing the oral condition of the patient, it's difficult to. That's why I said I can suggest what may be the reason, but
Mhm.
there may be there's some concerns about healing. But what happens with persons on aspirin? We call it aspirin therapy, a low dose aspirin for persons who may be prone to heart disease. And what the low dose aspirin does is keep things flowing freely. And so if the person were diabetic, their oral disease may not be um, uh, at an ideal position or ideal place. The dentist may have been concerned of excessive amount of bleeding because of the fact that the patient was on the aspirin therapy and then subsequently the slow healing as well. So it becomes a bleeding concern and also as a diabetic, a healing concern and introducing new bacteria into the system.
Okay, thank you for that.
You're welcome.
So this question, if a person grinds their teeth and wants to replace a few missing teeth to avoid chewing constantly on the left side, is it worth it from a financial perspective?
Absolutely. And this is why I started with saying to um, our healthcare providers and our partners in getting our patients healthy. If you cannot properly chew your food, the mouth is generally not designed to function on one side. And that's why we have a full complement of teeth. To properly chew and mash our foods adequately. And the idea is you put food in, it needs to be mashed up so that the nutrients, when you swallow and get it into your system, I mean, we all enjoy food, okay? I mean, we've become more and more foodies. That's a new thing. We're always talking about new foods and eating. Every function that we have, we're eating something. So you need to be able to properly chew that food. And so absolutely having missing teeth is important in aiding your function and being able to chew properly. Now, I have been like Chandra Misoya indicated, I've been practicing for 38 years, and I am absolutely amazed at what Bahamians manage to eat and chow down on without teeth. Now,
Mhm.
that's fine that can happen, but it's not being done well. That's the reality. They may be consuming these things, but we are not really getting full benefit of the food we're eating. And we have to remember, although we enjoy the food, there is a function for it, and the function is to provide us with the nutrients.
Yeah. So I'm happy that you made that connection because oftentimes we don't think about that. We just think, okay, a portion of our mouth is functioning, we're breaking down the food, but we think that we're fully chewing the food. But at the end of the day, it's not just for enjoyment, it's also for a nutritious value. Yes.
Primarily.
Yes. What method of replacement would you suggest? Partial dentures or replacement? That's the question.
Sorry, can you repeat that for me?
So the question says, what method of replacement would you suggest? Partial dentures or replacement?
Well, my first suggestion would be that the person asking the question see their dentist because that would be very difficult for me to answer without seeing the condition of a patient's mouth. There are multiple options. They are both removable and we call them fixed or permanent. Fixed, meaning that they don't have to be removed from the mouth. Removable obviously means that the patient can, in fact, remove the replacements from their mouth. And so there are cases where um, a patient is not a good candidate for multiple reasons
Mhm.
for a fixed replacement, but a removable replacement can adequately work as well. And so there are both options, and without seeing an individual case, it would be difficult to fully answer that question. But both options can be adequate for a patient.
Okay, thank you, Doc.
You're
Um,
welcome.
can you use peroxide, or do you recommend using peroxide to wash out your mouth? Full strength peroxide.
Absolutely not. Not full strength. Um, so hydrogen peroxide is is something that can be used to help in a situation where there is bacteria that is in the mouth that we don't want. However, we want bacteria. We want there's good and bad bacteria. I think we've all heard this. And so there's always bacteria in the mouth. And so there's going to be some bacteria. We don't want to get rid of all the bacteria in the mouth because then that creates a problem where we end up with thrush. So your mouth gets really, really white. Okay, and that too is a problem because then that's not bacteria anymore. Okay, that's a different problem. And so what happens is with the peroxide, if you were to dilute it, that can and rinse with the diluted 50-50 peroxide. If you have an area of the tooth that or the gum that is a little bit inflamed and there's bacteria under the gum, what that does, when you see the bubbling of the peroxide, it's releasing oxygen. And so the bacteria that live under the tissues don't like oxygen. So you're introducing some oxygen. So that helps to decrease the viability of the bacteria that's living underneath the tissue. But that doesn't negate the fact that you need to go and have that bacteria removed. So the peroxide does not get rid of the bacteria, but it just diminishes the ability of the bacteria to multiply, be simply because the bacteria that live under the tissues don't like oxygen, but
Okay.
definitely not full strength.
Yes. And that's why it's very important to speak to the professionals, right? Go
Yes,
to the healthcare
absolutely.
professionals for
Yes.
guidance.
And
Yes.
and get your mouths healthy. Once we
Hmm.
remove the bacteria that we don't want there, then things will be a lot better for everybody.
Yes. And what about rinsing with warm salt and water? Would you recommend that?
Um, yes, it's not. We don't want to. I don't want people to feel that it's the begin all and end all of taking care of your mouth. Okay. The warm water, and so we have to understand what these things do. Warm water and salt will help with the healing. Okay. If there is some open wound, we know that if the patient has had, say for instance, a deep cleaning, that the warm water and salt will help and aid in the healing of the tissue,
Hmm.
but it doesn't get rid of your disease.
Yes.
Okay?
Mhm. That's a very good point to, to address. It doesn't get rid of disease. Yes.
Correct.
Hmm. Is there a recommendation for toothpaste that provide better benefits, such as whitening? So that's the first question. And then the second question is also, what is your view on the fluoride debate that is happening in the United States? That's currently happening in the United States.
Okay, well, the first thing is well, about the toothpaste and whitening. Uh, Whitening is not necessarily a benefit of the toothpaste that we all necessarily want. Whitening and some of the toothpaste can create a lot of sensitivity. And so you've got to be careful with using the whitening because then your teeth become very, very sensitive. So we do want to be careful. The fluoride has been a debate for many, many years. It's not a new debate. It's a debate. It's been a big debate for many years in the dental profession. And in the United States, I will speak briefly on it. There are lots of debates going on in the United States about uh, healthcare and medication and things that preventive things. And fluoride was intended to be a preventive mechanism. So just to get into a very tip of the science of the fluoride. Fluoride combines with minerals in tooth enamel to make it harder. And so many, many years ago in the United States, fluoride was introduced to water that was being consumed. And in most states, many years ago, we drank water from the tap, or the Americans drank water from the tap. And so the United States thought that the best way and the easiest way to treat children, particularly because it happens as the enamel, as the teeth are developing, would be to add fluoride to the water. And so that is what they were doing. And they were supposedly having control of the quantity because it is a supplement. And so it has to be controlled. Too much of anything is good for nothing. So that was part of it, that a lot of states, a lot of persons are now starting to think that or feel that you're giving me medication, a supplement without my knowledge, without my consent. So that is part of what the discussion has been. However, in the Bahamas, many, many years ago, I mean, very few people I think now probably are drinking tap water, but in some islands, the level of fluoride was higher. And like I said, too much of a good thing is good for nothing. And some of those islands, and I'm not going to, and I please don't ask me to say exactly which ones, but I have seen them. Like at this moment, I cannot recall which islands, but there were some islands that had high levels of fluoride in their water naturally. So fluoride is in, there are minerals in all water, and you'd have to have the water properly tested to see what there is in it and the levels that there are in the water. And so there are some islands that we've seen persons that would come and see us in our offices that were from these islands that had very high levels of naturally occurring fluoride, and their teeth would be very, they would be dark. They would be stained, sort of like a brownie, sort of rusty sort of tinge. But the other thing is that those teeth were very hard. And so those persons were not likely to get cavities. Okay, because the bacteria could not break through. And bacteria is what causes a cavity. The bacteria simply can't break through. And that's why fluoride was encouraged, because they wanted to reduce the level of decay. Because if the teeth are that hard, then the bacteria has a harder time of breaking through the enamel and causing decay. That was kind of roundabout. Sorry about that.
No, but it was thorough,
Okay.
especially for persons who may not be familiar with the current debate that's going on. So thank you
Yeah,
for that.
it's just that this whole freedom of rights, freedom of choice, freedom of speech, we want to be free, and so people, Americans, are just saying they don't want to be treated without consent.
Yes.
That's what it boils down to.
Okay. So, Doc, I think we have about two more questions that came in.
Okay.
And the first question, and after this, we will turn over the mic to Mrs. Cece LaFour. She's the VP of Human Resources, Wellness, and Facilities here at the Authority. But the first of two questions, what is your view on homemade toothpaste made particularly out of coconut oil, baking soda, salt, and mint oil?
My take.
Yes.
Um, you can actually all these things are adjuncts. Okay. The toothpaste is really not the media that's removing the plaque. It's the proper brushing technique with a soft, and I'm going to put that in here, a soft toothbrush, and not scrubbing your teeth. And so all of those things have medicinal or healing properties. And so there's nothing, I have no objections to patients using homemade combinations of things. Um, as far as, again, being careful of your quantities. And that's one of the things we like to want to use our natural ingredients, but we have to remember that these all of the ingredients have chemicals in them. And so you have to be concerned about how many chemicals you're putting together and the subsequent effects of those. And so, no, I have no objection to it. Obviously, will encourage the use of fluoride, particularly in children and developing teeth. So certainly that is probably why you'd want to use fluoride with or toothpaste with fluoride, particularly for children. But for adults, as Bahamians would say, we done grow. So um, there's not a whole lot of addition that we can put into our enamel, but we can remove the plaque and adequately removing the plaque with an adjunct that we like, then that's fine.
Thank you for that. The final question, Dr. Jill. Doc, what can you speak to the small and in quotation smelly particles that form at the back of the tongue? Can you tell us what they might be? I know. I tried to make it make sense, but yes.
The small, smelly particles on the tongue. Okay, so
Yeah, that
I
form
talked
at
about
the back
brushing
of the tongue,
at the
yes.
back of the tongue.
Uh-huh.
Now, what happens is that the tongue, and I did not say we didn't get into the cleaning because we were talking about the whole health.
Oh, yes.
But we talk about brushing your teeth. That's one of the things in removing bacteria. But the tongue is like a cushion for bacteria as well. And so the little uh I'm trying to keep this as simple. The taste buds that are on the tongue are almost like velvety. And they move and they go back and forth and they can trap things. And so brushing the tongue is also important. Okay, because a film of bacteria will develop on the tongue. And so the things that we eat will also get embedded in the plaque that's collecting on the tongue. Um, Anything that's sort of getting stuck back there that can be removed is probably just a calcified or hard deposit of plaque that may attach to or in the area of the back of the tongue. But it can also be some other things. So that may have to be if you're looking at it, it also can develop on the back of the tonsils, but usually they're nodules of bacteria. And so bacteria smells.
Mhm.
Bacteria smells in the mouth. Let me give you very quick, and I know we want to wrap up example of a bacteria that I think most Bahamians would have had and how smelly it can be. And this is what I tell my patients. If you don't remove the bacterial plaque properly from your mouth and let it sit around, or decayed teeth that are full of bacteria. If you made a pot of rice in the middle of the summer and you left that pot cake in the pot overnight, and you go the next morning
Mm,
to
definitely.
and open it up, do I need to say more as to how
Nope.
it smells? Okay. And that is how quickly bacteria will develop around something that's left out. And it's the same thing. That food that's left in our mouth, if we're not brushing our teeth properly, the bacteria will attack that. It will eat the food that we leave around in our mouth that's not been properly removed, and it will eat, and all living organisms that eat will excrete, will get rid of something. And what the bacteria gets rid of, it's in the form of an acid. And that is what destroys and causes a lot of tooth destruction. But it
Mhm.
also will wreak an awful odor in the mouth as well.
Yes. Thank you. And I think that was the perfect way to end the question and answer segment with that scenario, because it brings you back to reality. It brings you back to making sure that you're regularly and properly cleaning the teeth, reminding you to do it often, and to remove those food particles that lie there and remain there after meals. Um,
Absolutely.
And so, Dr. Jill, and to our listening audience and our viewing audience, I want to turn over the mic this afternoon to our Director of Human Resources, Wellness, and Facilities in the person of Mrs. Stacey LaFleur for our vote of thanks.
Great. Thank you, Chandra. Dr. Gibson, wow, this was so incredibly informative. I had a number of takeaways. I think you started off with you are what you eat. And you're right, we always hear that, right? But when you think about the way you graphically described it, it goes in our mouth first, right? We probably think about it afterwards, like, okay, how is it affecting our body? But the fact that, that's the intake of this, right? And how best can we have a proper diet without proper dental hygiene? Um, I think about I have two sons who are now young men, but when we teach our children to brush their teeth, what we go through painstakingly. We have a song and it takes a while, and we talk about proper hygiene, dental hygiene, and it doesn't always carry over to adulthood, I feel. You know, I feel we do a lot of attention when we're younger, and then we come back to it when, oh my gosh, we have a toothache or something's wrong. And we want you, Dr. Gibson, to perform a miracle, right? We
Absolutely.
want you, we want you to give us those teeth that we had when we were younger. But
Absolutely.
unfortunately, we didn't do what we needed to do to get there. So this was so incredibly informative, sharing with us really what's important. And it's important, just like here at the National Health Insurance Authority, we talk about prevention. And I think that's definitely key as it relates to dental health and dental hygiene. I also want to say thank you so very much. Currently, dental services are not covered under our benefit scheme. We're certainly hoping as we continuously add benefits to our offerings, that it certainly will be in the future. But this speaks so highly of you, Dr. Gibson, right? Meaning that this isn't covered under our scheme. You're not a dental provider for the National Health Insurance Authority, but you're taking time out to say this is for the betterment of the country. It's the betterment for everyone involved, regardless or not if it's tied to the National Health Insurance Authority. You took the opportunity to want to educate and to do it on your own time, your own fruition. And for that, we say we're thankful and we're grateful.
You're welcome.
Yeah.
My pleasure.
Mm-hmm. Chandra?
Yes, and so just to wrap up our call this afternoon, here's what to look out for and what's in store for you, provided by the National Health Insurance Authority for the month of during the month of October. October is Breast Cancer Awareness Month, and so we'll be promoting everything that's breast cancer awareness, as well as encouraging those of you to get proper screening and testing for breast cancer. So on Thursday, October 23rd, you're welcome to join us in our courtyard between the hours of 12 and 3 p.m. for our monthly farmers market session. At the farmers market, you can also stop by, enjoy lunch, and also purchase a chair massage through our mindfulness space. On Wednesday, October 29th, and this is not the flyer, but we will drop the flyer once it's completed. Our next topic will speak to mental health and breast cancer survivorship. And our guest speaker will be Dr. Stephanie Hutchison. And so we encourage you to log on to our social media platforms, such as Facebook, Instagram, YouTube, as well as for those that are beneficiaries, if you are on our mailing list, you'll receive more information about mental health and breast cancer survivorship during the month of October. And then on Thursday, October 23rd, we're inviting you to join us for our fourth annual Pink Party for a Cure. And at this initiative, we will be distributing free mammogram coupons while supplies last. And so we encourage you to join us on Thursday, October 30th at 5:30 p.m. at the Holy Cross Anglican Church in their parish hall. Should you wish to contact us if you need further information, if you want to be reassigned, if you're trying to find out your NHI status, you signed up for the program and you're not sure if you remember who your provider may be, Feel free to contact us via email. Our email is info@nhibahamas.gov.bs. Feel free to pick up the phone and give us a phone call, and you'll hear a friendly voice on the other end of the line. Our telephone contact is 396-8500. You're welcome to follow us on Facebook, Instagram, LinkedIn, as well as Twitter. And we also have a YouTube channel. Should you wish to just text us, feel free to text us on our WhatsApp line between the hours of 9 a.m. and 5 p.m., Monday to Friday at 813-2800. And as always, you can log on to our website at www.nhibahamas.gov.bs for further information. Again, we thank everyone for taking the time this afternoon to join us. And for those who would have queried the recording will be posted on our YouTube channel as well as our Facebook page. And so we encourage you to log on to those platforms, click the share button, and share the information that was shared with you today so that we can create a healthier oral hygiene practice in our lives and in the lives of our family and friends. Thank you, everyone. Have a beautiful Friday and a wonderful weekend.
Thank you. Well done, NHI.
Thank you.